Phobia is a extreme fear, irrational fear, extreme anxiety disorder. It is basically a mental illness. My name is Dr. Kailash Mantri. I am a life coach and a mental health consultant. For the last 25 years, we have been researching on more than 100 mental illnesses which we have been able to cure without medicines. Today we'll be talking on phobias. It could be about a situation, about an object, about living creatures, and it could be about a place also. If a person is gripped with phobia, he will do anything and everything to avoid the situation which will cause phobia in him. He will avoid to do things which he thinks are dangerous. A phobia is an irrational fear about something which is rarely going to harm you in real life. There are mainly two types of phobias. Social phobia, that means meeting people, and specific object phobias, maybe flying, elevators or place. It could be of living creatures also, like insects, snakes, spider, monkey, tiger, any living creature which is deadly. All phobias start with basic fear, and by imagination one exaggerates the fear and it converts into a phobia. The earlier treatment is better, and the more delay you create, there is a more grip of phobia in your life. Phobia treatment is basically irrational fear treatment and anxiety disorder treatment, but at a very high level. Now the good news is all phobias are curable within a month. It does not take more than 30 days the person to be out of phobia, but 30 days means almost 300 hours of treatment. And the treatment is basically to increase your confidence, to make you experience your power, to make you experience that you are bigger than the problem. Now let's see what are the examples of phobias. Fear of public speaking is the biggest phobia majority people have. Sometimes people have phobias of open space, sometimes people have phobia for closed space. Darkness, flying is very popular area for phobias. Driving, snow, spider, bugs, snakes, death, height, bridge, tunnel. There is a phobia for failure and rejections also. Now let's discuss the myth about phobia. First myth is it is genetic. It is not. Second myth is it is a neurological disorder. It is not a neurological disorder. It is basically psychological and emotional disorder. Yes, if the elderly family members have some phobia of something, the child observing at the early age can also develop the phobia, but that's only by observing and trusting the parents. Negative experiences is the biggest reason for phobia. The person has to experience negatively, either physically or psychologically, and that negative experience is inbuilt in his mind, and he freezes himself and does not participate in the activity. Yes, past incidences, past events, and the traumas which the person has undergone in his early age, maybe an accident, can cause phobias. Now let's see who are at risk to attract phobias. First is the age. The younger the age, the higher the probability of getting this phobia. If one of your close relatives is suffering from phobia, and by observing the close relative you can also develop the same phobias. Your temperament also could aggravate the risk factor. If you are sensitive, overprotective, fearful person, you may be trapped in phobias. If you have experienced anything negative in your life, maybe some accidental death in your family, you may develop it. If you are attracted and hear more about the negative experiences of people, you may also develop the phobia. Now let's discuss the sign and symptoms of phobias. Abnormal breathing, accelerated heartbeat, chest pain, butterflies in stomach, dry mouth, confusion and disorientation, headache, dizziness, high blood pressure, shivering, hot flashes, etc. Now let's discuss the complications for people who have got phobias. Social isolation, people will avoid these people, and these people will also avoid peoples. They will have mood disorder, mood swings, they will become unpredictable. More likely that they will go into substance abuse, that is, they will go into drugs, alcoholism, chain smoking, tobacco chewing. They will suffer from uncontrolled anger. Their marriage life will be disturbed. Their work, they will attract more workplace stress. Their job will not be stable, and they may often have suicidal thoughts. Now let's discuss the traditional treatment method, which are all failures, which does not last long. Yes, temporary relief is there, but there is no permanent solution. The first is CBT, cognitive behavioral therapy. Second is exposure therapy. And the person has to made experience, he has to expose to all the things which he is fearing, and which is unlikely that he'll be willing to do that. If he is willing to do that, the phobia disappears. So it's only theory on paper and it is not practical. Third is hypnotherapy, which is outdated. The effect does not last long. And the fourth is medication, which is most dangerous and it has got zero effect. We have developed a very powerful technology for treating phobias. Normally we take minimum 10 days and maximum 30 days to treat it. It requires minimum 100 hours and maximum 300 hours to treat the patients. And our treatment is only increasing his confidence, only deleting his all past bad memories, only dealing with his fear, anger, anxiety, overthinking nature, exaggeration nature, taking things seriously, dealing with all these things and making him experience the power which is within him. We have developed a very transparent test. We have named it as mind mapping. There are more than 500 questions into it, and within an hour, the person gains confidence that I can be out of the phobia, and he starts cooperating so that he can be out of phobia. My name is Dr. Kailash Mantri. We guarantee the treatment of phobias, and the progress could be seen in 5 days also. Phobias are 100% curable. There is no need to suffer from phobias at this age.